This is a hospital progress note. It contains 81 words. To figure out what it's worth, we need to determine the level of care by taking apart the history, the exam, and the medical decision-making, and plugging that information into this table, which shows the documentation requirements for hospital progress notes. For these encounters, 2 out of 3 key components are needed. You can use either the 95 or the 97 guidelines. In this case, both guidelines work out the same, but I'll use the 97 rules to take apart the note. Starting with the history, this table tells us what level of history has been recorded. First, we have a valid chief complaint. Then, looking at the HPI, we say the patient developed abrupt onset of severe palpitations this morning associated with shortness of breath, denies cough or chest pain. Here we get credit for documenting the context of the problem, the severity, the duration, and associated signs or symptoms, which adds up to 4 HPI elements, which means this qualifies as an extended HPI. There are no elements of PFSH listed, but we did ask about cough or chest pain, which would give us credit for reviewing the respiratory and cardiovascular systems. So going back to our table, now we have an extended HPI, no elements of PFSH, and 2 systems reviewed. At first, you might think this qualifies us for an expanded problem-focused history. However, there's an exception regarding past medical history for hospital progress notes. Both the 95 and 97 guidelines state that for certain categories of E&M services that include only an interval history, it is not necessary to record information about the PFSH. Those categories are subsequent hospital care, follow-up inpatient consultations, and subsequent nursing facility care. Therefore, this 1 out of 3 elements of PFSH becomes none, which means we do qualify for a detailed history, so the first key component is now known. The next step is to check the physical exam. Looking at the exam and using the 1997 guidelines, here we get 1 bullet for recording 3 vital signs, 1 for listening to the lungs and 1 for listening to the heart. That adds up to only 3 bullets, which means we'd only qualify for a problem-focused physical exam. So the next key component is now known. The last step is to check the medical decision-making. Looking at the medical decision-making and starting with the problem points, here we have a new problem for which further workup is described, which means it's worth 4 problem points. Next step is to check the data points. Looking at the data points, here we get 1 data point for reviewing labs, 1 data point for ordering the EKG, and 2 data points for reviewing the EKG. This adds up to a total of 4 data points. The next step is to check the risk. Looking at the risk, the pertinent part of the risk table is the high-risk part, because we have a problem which poses a threat to life or bodily function in new-onset Afib with rapid ventricular response. Or you could argue that starting the patient on a diltiazem drip or IV heparin would constitute drug therapy requiring intensive monitoring for toxicity. So either way, this definitely qualifies as a high-risk encounter. So we have 4 or more problem points, 4 data points, and high risk. So even though only 2 out of 3 dimensions are needed, in this case all 3 dimensions point toward high complexity medical decision-making. So the last key component is now known. Going back to the documentation grid, now we know we have a detailed history, a problem-focused physical exam, and high-complexity medical decision-making. And for hospital progress notes, since only 2 out of 3 key components are needed, this adds up to the 99233 level of care, otherwise known as a level 3 hospital progress note. When you put it all together, this is how the final note looks. Remember, only 2 out of 3 key components are needed. Here we have a qualifying detailed history, a non-qualifying problem-focused physical exam, and qualifying high-complexity medical decision-making. So here the 99233 level of care took us just 81 words to construct and is worth $100, which works out to $1.23 per word. Thanks for watching Case of the Week. If you want to learn how to document your encounters this efficiently, consider signing up for one of our web-based E&M coding curriculums. We offer several different subscription options to match any practice pattern. For E&M coding education for multiple providers, let us build you a customized E&M compliance web portal which provides centralized, trackable, and verifiable E&M coding education for multiple doctors.